We have, trod this path before. We have been there. I mean, we lost a lot of days in 2024. We don't want to go back to that, and so we ask them to really come forward and raise their issues.
Government's position on that, because it's going to affect a lot of facilities across the country. The second one is on the issue of, is it that the government has lost touch with the Kenyans? Because for the few years I've lived, I've never seen such a thing where Kenyans are now writing to international bodies. So we saw ICC, we saw the land visit, they are writing to them, telling them don't come. What is really happening? Why is Kenya Kwanza really not in touch with these people?
Good morning, my name is Dennis Tisaka from KBC, and actually my question is on social health authority. There have been claims that the government has not committed to some hospitals. That you are certain on that.
Okay, thank you, Lawrence. For the clinical officers, I still want to ask them to really be patriotic Kenyans. We have just come from resolving the issue of intern doctors, and we have expressed goodwill in this regard. We are very committed to honoring the CBA with the clinical officers, and I don't think jeopardizing the health of fellow Kenyans is good, because we have, trod this path before. We have been there. I mean, we lost a lot of days in 2024. We don't want to go back to that, and so we ask them to really come forward and raise their issues. We have, trod this path before. We have been there. I mean, we lost a lot of days in 2024. We don't want to go back to that, and so we ask them to really come forward and raise their issues with the Ministry of Health so that we can resolve them. Because, we cannot be coming from one strike to another. I mean, it becomes very difficult to ensure that Taifa Care is working. And also, let me combine that with the question from Dennis. We have realized as a government that there is dishonesty also on the side of hospitals, because when you have a payment, or rather a procedure approved by the SHA, but then people are being told to pay, that is sabotage. And there's serious sabotage from various hospitals. So the government is very keen to put in place a system where even you can tell how much was paid for your medication, because that lack of transparency is what was making the NHIF to have fictitious claims, and that is what people are fighting back, because then NHIF became a cash cow. So there are teething problems there, but believe you me, us, the government has committed before, we are on course to ensure that every claims are paid and that people do not pay cash just because some people want to frustrate this process. And really calling upon the people in the healthcare sector, please do not frustrate this, because it's about me and you. It's not just about the government. Government is, it's what is commonly good for us. So I think that's where the problem is, the disparity between what is being approved by SHA and also what you are being told to pay. There's a challenge there, and it's a question of transparency. Now, my friend from Horizon TV, we are living in very interesting times, and I think I need to address this issue because it is not just Kenya that has this challenge. The biggest threat, the existential threat to our sovereignty and our nationhood currently is misinformation and disinformation. Because lies have been digitized. And everyone is able to be a newsmaker. So much so that there is no leverage. And we have a study that shows that Kenyans are consuming news from social media 50%, then from the mainstream media. So anyone can wake up using their small station called Twitter or X account or Facebook and create some lies just to attract traffic and likes. And then out of that, people are using technology or misusing technology to even generate some emails to damage the reputation of the country. So it's a big, big, big issue. It's a really big issue. And the government has really restrained itself in terms of, coming into that space and, trying to curtail some of those things. Because we believe in responsible citizenship. And therefore, there should be responsible citizen journalism. So it's not because the Kenya Kwanza or the broad-based government or this administration has lost touch with Kenyans. We are very much in touch. That's why we are engaging with you, because you are the ones who interlocute between our communication and the populace. That is why His Excellency the President and the Deputy President, Kithure Kindiki, are actually out there in Western, and later on they will be going to Northern Kenya to meet one-on-one with the people. That is why we even do press briefings out of Nairobi, as we shall be doing shortly. But the question is, are people also responsible enough to ensure that they love their country? And that's why you keep on hearing me insisting on issues of patriotism. Because a patriotic Kenyan will not work to jeopardize the progress of his or her own country just because of difference of political opinion. So really, I am making a passionate call for us to really remember that every partnership that we create with a different country will benefit a certain Kenyan somewhere, and it could be yourself. When we go and negotiate with the countries like Germany, and we are able to have Kenyans go and live abroad, and they are making money, and they're able to support their families, it benefits all of us. When we make agreements with the country like Netherlands, having the monarchy there visiting here is a great thing. So let's just agree that sometimes we'll have differing opinions, but not to the extent of sabotaging a national interest out of popular public opinion that may just be momentary. Good. We can have another set of questions, if any. Asanteni sana. Mungu wabariki. Kenya itainuka. Kenya itasimama. Kenya itanawiri kwa umoja na uzalendo. Mimi ni Mkenya mzalendo. Je, wewe? Asanteni sana.